Over the last 100 years, Northwestern has shaped generations of the most talented neurological surgeons nationally and globally. It is remarkable to recognize this accomplishment and our commitment to improving people's lives. Join us in celebrating the 100-year anniversary of the Department of Neurological Surgery residency program.
This is a department that is more than just a group of professionals under an administrative umbrella. We actually like and respect each other. We want each other to succeed. We look after each other. And in medicine, that is sometimes hard to find. And that collective energy of having each other's back and thinking of each other as a professional family, I do think brings out the best in all of us. And at the end of the day, the patient benefits from that.
In 1924, Dr. Lowell Davis founded the neurosurgery residency after training under Dr. Conoval with an emphasis on the neurosystem, peripheral nerves, and decerebrate rigidity. Dr. Davis was the first surgeon west of the Appalachians to limit his work to neurosurgery, thereby establishing Chicago's first neurological service. In 1954, during Dr. Davis's tenure as chair, Dr. Paul C. Busey joined Northwestern University as a professor. For the next 9 years until Dr. Davis retired in 1963, Northwestern University had 2 independent neurosurgery residency programs. One was headed by Dr. Davis, who was centered at the Passavant Memorial Hospital. The other, under Dr. Busey, was at Chicago Wesley Memorial Hospital. He established the first spinal cord injury unit in Chicago and implemented an active cranial and spine surgery program at Northwestern University. In 1967, residents began rotating at Evanston. 2 years later, the departments at Children's Memorial, now known as the Ann and Robert H. Lurie Children's Hospital of Chicago, became more closely linked with Northwestern University. Pediatric neurosurgery joined the university's training program in neurological surgery in 1969, at which time Dr. Anthony J. Raimondi was appointed head of neurosurgery at Children's Memorial Hospital and professor of neurosurgery at Northwestern University. Dr. Busey retired as chief of neurosurgery at Northwestern University in 1972. 15 of the residents who trained at the university under Dr. Busey went on to have distinguished careers in neurosurgery across the country and around the world. One in particular, Dr. Raimondi, became chair of the department in 1972 after Dr. Busey retired.
I got involved in neurosurgery as a resident 75, 76, 77 as a fellow, which I taught myself over here because there was no fellowship around the country. Then in 79, I got to be attending in charge of neurosurgical anesthesia at Northwestern University. And we were one of the first doing neurosurgical anesthesia anywhere in the country. So that was a good start. Dr. Bendak, Dr. Pager were big, as others also, in neurovascular surgery, which means clipping of aneurysm, resecting of AV malformation, arterial venous malformation. Often you have a situation where the aneurysm, when you are working, before you get to it to control it really good, it can rupture and bleed. And now the situation is worse. So what can you do? We came with the utility of adenosine asystole. Adenosine, we have it in our body, but we give it in a bigger dose. So we give the adenosine in a dose big enough to have heart stop for about 10, 15, 20, at one time about 60 to 70 seconds, 1 minute, no heart at all. There's a flat line. In doing so, there is no blood flow to that area, so the surgeon can see where is the bleeding to put a temporary clip on it, or could see the neck to be able to clip it. And we were, and still actually, I would say till now, the #1 department around the country who utilized that.
We became a true card-carrying member with responsibilities to educate medical residents and to advance the science of medicine through research, in addition to our other educational medical care responsibilities.
You know, after I finished training, I did subspecialty fellowships in skull-based surgery. And when I came back to Northwestern as an attending, one of my goals was to someday build a lab and offer that experience to not only our neurosurgery trainees, but neurosurgeons in the community from around the world, in fact, who might want to explore new techniques in a safe, mentored, and comfortable environment.
When I was recruited to Northwestern to expand the functional neurosurgery program in 2003, the program was very small. Over time, we've seen the program grow dramatically. We have added faculty. We now do functional neurosurgery procedures at 2 of our major hospitals in the health system. We're the busiest deep brain stimulation program in the Chicagoland area. We're the busiest epilepsy surgery program in the Chicagoland area. I would say about half the procedures that I do are procedures that we never used to do.
Spine program's come a long way in the last 20 years. Our Center for Spine Health is definitely cutting edge. We help design and develop the next generation of implants here. Many of our surgeons have collaborated with our industry partners to develop systems that work better, more efficiently, and allow us to do better work for those patients.
Part of my vision was really to try to instill a culture of innovation where the science would actually be driving some of these discoveries in the OR. SPORE is a program which is administered by the National Cancer Institute, and it stands for Specialized Programs of Organized Research Excellence. We are one of 6 centers in the United States that has such a SPORE, and therefore it allows us to be recognized as one of the national leaders in the treatment of brain cancer.
The Malnati Brain Tumor Institute has its origins really in the philanthropic spirit of the Malnati family. They began to support the Brain Tumor Institute, and at some point they wanted to make a transformational gift to ensure that we have the resources to essentially exist in perpetuity.
When you look at 51st president of International Society for Pediatric Neurosurgery, 24% were trained at Chicago Children's Memorial Hospital. I'm very grateful for Dave Macron and Raymond gave me the opportunity to work at such a premier children's medical center.
This is one of the points of light for pediatric neurosurgery in the world. And we're committed to making neurosurgery better than the way we found it. We've done so many first ever surgeries in the world. We're inventing procedures. So many visitors from around the world come to us to learn our techniques and to share ideas, and then to bring that knowledge back to their home countries to be able to help kids.
I think the advances in cerebrovascular care at Northwestern really provide a role model for how such programs should be initiated, fostered, or grown at any other institution. Effectively, we now are able to bring all of the open surgical techniques as well as all of the minimally invasive endovascular techniques in one room dedicated to image-guided neurosurgery. So by combining technologies and teams, we can offer patients the best treatment in one stop, under one anesthetic, the first time.
One word I'd use for the Department of Neurosurgery at Northwestern is dynamic. The only certainty in life is change. And we're able to roll with the punches together because we work together and we trust each other.
Historically, we gather around the holidays, and it's a time where people are not seen as the neurosurgeon or the nurse or the administrator. We come together as human beings. There is a rich spirit of family, of wanting to make a difference, and the teams collectively, I think, make a very favorable impact on the field of neurosurgery and, most importantly, the care we provide our patients.
Right now, I think you'd be hard-pressed to find a neurosurgical center in the world that excels in the areas of neurosurgery that we do. There are very few things in neurosurgery that we don't do in a way that ranks with the best places in the world. And when I look at my partners and see the kind of facets of care we bring to patients, it's an honor to be here.
Sometimes people have underestimated us as a newcomer to the field, but we're just getting started.